go over some inventory here. Food. Let's see. 5 French. Bipolar balloon. Stem catheter. Stem catheter bipolar 2 millimeters. So 5 French, so it's gotta be about 6 French. 2 millimeter pin. Yeah, it's gonna be 5 French catheter. Alright, let's see what we got here. Look like an acetate balloon here. Just one Gans test tube, 7.5 French diameter. That's gonna go into an 8 French then. The French, it's an 8 French swan. This is your 5 French, 6 French. So it's gotta go into a 7 French, huh? Alright, gotcha. Got your standard jackies and your tigs, 445 tigs, jackies, 40 tigs, 40 tigs, 45 tigs, 5. Got your multi-pack here, FR4, FR4, FR pigtail, good. J3, J4, J5, J4, L1, J6, LBC, pigtail, 5 French, yeah, 5 French, 6 French, pigtail, 6 French, 5 French, yeah, 5 French, what do we got here? 1030 piecer pack here. This is, what do we got here? What's the same June to the pacemaker sheets? Oh, it's a temporary pacemaker box. Okay, that pacemaker. Okay, gotcha. All right. Oh yeah, this is the pacer packs here. Pacer packs, pacer tool set. Okay. Perfect. Let me got your Graphmaster 2.8 3535, 19 millimeters. Expiration date 2019. That's good. These are for perforations of vessels here. Dissections of any vessels. Filter wires. Okay. Filter to remove. What's a fine cross catheter? These are micro catheters. It's a fine cross. It's to get through very tightly occluded vessels, and also to for peripheral work here. Fine cross is also used for intracoronary infusions of medication. Once you pass a lesion that is too risky to pull out, you don't want to lose position. It's a snare system in case you got to get something out of it, like a piece of a wire that broke off. Quick cross. These are very stiff wires that'll go through glide wire advantage. This is used mostly for peripheral work here. Yeah, it's a 260 wire, so it needs to have some length, and they use it because it's a hydrophilic coating that will glide over water and it stay very lubricious or sticky. The Express is something similar to the Export, which is just an extraction catheter for a clot. And when there's a thrombus formed, we have to put this extract catheter and put it in and try to suck out the clot. So it's an export catheter, aspiration catheter. Got the volcano. This is a Verada pressure wire, so this is going to check the pressures pre-stenosis or pre-occlusion and post-occlusion to see if there's a gradient in pressures, to see if there's any demand. So if the vessel is active, it's going to be demanding nutrients and oxygen in blood, and if it's already gone into some kind of an infarct, it's not going to have any activity, any demand, so the pressures aren't going to be in the range that we need for demand. So Eagle Eye Platinum, that's the ultrasound, intracoronary ultrasound that we use to visualize internal vessel patency and lumen. The Guidezilla is just another guide wire that, wow, I think this is it's an extension catheter. Okay, you hooked it up to extend it. Guide extension. All right, so if you need to add some length to it. Okay, good, good, good. That's good, good stuff. And we got all our, these are all just our guided catheters, which are a little different. The guided catheters have a little stiffer material here to maintain its shape. These are already pre-shaped to adhere by the coronary anatomy, making it easier to just fall into place opposed to an all-purpose catheter, which was what they used in the past. It just had no curvature, just a little straight, and you just find your way in there, and then you guide in with catheters, and you put a wire in there, and you maneuver it with the wire. So left LCV, AR, right, left, just different variations, different curvatures. It falls right into certain vessels. These are vessel specific. All right. Got a nice long table here. Got your cath bag here with a lot of all you need for the procedure. All right, go to cart, sharps, go to cart. Defect pad ready to go. Hasn't been checked in about 3 months. January 1st. January 1st. That's not good. Go to cart. This is coagulation and cautery device here. It's a bipolar machine that gives you cautery. So when you can cut skin and you can burn skin is what it's saying. So you cut the skin off, and it prevents bleeding because you kind of cut and burn it with the plasma blade. And then also you are sit there and singeing areas of bleed to make it clot and coagulate. All right. Blanket warmer here. Beauty. They're warm. This is an intra-aortic balloon pump, which is the attachment here is the pump portion of the balloon pump. So the balloon goes inside your aorta, and this inflates with your pulse rate to give you the dynamic gradients needed for your chambers to load and unload, for your preload and afterload to offload itself. And if you know the dynamics of the chambers, you have to have certain pressures to equal to each other to have a movement of those leaflets, because they only go one way. So if you have pressure on the area of the leaflets that are supposed to push away from the entrance, then there's enough pressure. So you have to have a balanced, equal pressure where they just kind of loosen up and dangle and pick up some of that blood to flow, and then they flap when there's a difference in gradients and pressure. Co-pilot, this is just an attachment to the end of the catheter, and it's just it's a device that closes the exit of a catheter so you don't have any pressure gradients and it doesn't leak blood. So when you want to put wires through it, you open that up, slide the wire, get in place, but that loses all the pressure on your pressure wrist, and then you got to lock it up. It'll create that pressure again, and it'll give you pressure into coronary arteries here. That's your gowns, contrast, ISOView. ISOView is what you use here. TR bands. Those are your radial closure devices. And you'll see this is your closure devices for femoral region here. Femoral entry. That is going to put a piece of collagen into the arteriotomy the area that we access. So it's the hole basically that we poke through the arteriotomy. Stat locks. This is a manifold portion of the assist, which is going to be hooked up to the assist automated machine. This is connected to the saline, pump saline, and this is also going to be connected to the contrast, to pump contrast through here. Well controlled through computer mechanism and computer algorithms. This is just your little plunger to push. Cool. Cool. So that's good. This is your computer system that needs to be in its own separate region to be cooled. Sutures. Casagrand sutures. This is just wound care stuff. Gloves. Surgery flow. This is a hemostatic solution here. I don't know if I said hemostatic. Yeah, hemostatic solution. It's a hemostatic matrix. Hemostatic matrix, and this is just to put inside areas of bleed to make it clot. It's a hemostat. That's what they call it. Hemostatic matrix solution. Good. Cables. Cool cables. Cathlab. Oh, that's your procedural stuff here. Upside stuff. These are your wound care stuff here. Markers. Got to mark your pacemakers, or the region of interest is what I'm saying. Pacemaker, or whatever leg that we're going to be going into for our entry. Suture removal kit. So familiar with that. Caps, blades, scalpels. I'm saying usually they use a 15 blade for most of the skin blades there. Decanters to get your saline pop there. Oh, there's your IO band. This is antimicrobial covering that you put. It's a little clear brown, collagen wrapping that you put over the area that you've washed before surgical procedures, and that's just another addition on top of the skin to, once it's scrubbed, you cover it so nothing lands on it, you cut through it, and it just leaves all that area nice and covered and sterile. There's your pumps. This is your computer on wheels here for charting, medication ordering, doctor's ordering, patient care, and communication. That's a pretty nice one. This is your Pyxis, or this is your Omnicell, whatever they want to call it. This is a Pyxis here. Just a medication dispenser device, and it's you got to have your badge, you got to have your fingerprints. Pretty intense. Waste. All right. Purpose cleaners are just supplies because that's your this is your reference computer for your blood pressure, and all your EKG leads are up here. That's nice right here. It's good. Left RALA, RL, those are your leads for your cardiac procedures there. And syringes and other medications, and saline for the nurses. Fridge. There's certain medications that need to be in the fridge, and it's usually Angiomex for anticoagulation or coagulopathy therapy. Guide wires. BMW, universal standard. BMWs are used a lot. Pilots, they're all about the same. The one that they use a lot is, I guess I've used them all. It's weird. But it looks like they like the BMW and the Pilots here. Alright. The difference between the BMW and the Pilots, just the difference in their tips here. Some of these are shapeable, or more specifically, they retain their shape a lot better. So you bend this one and you create a curvature that'll guide your wire into certain areas. Other ones, you can bend it, but it just kind of falls back into place. Just a very subtle, change. This is an extension here. You just add it to the tip of your wire. So as to say, if you need a little extra, a millimeter to get to where you need it to be, you go and you add that and you get it. You don't want to leave a wire too short. That's for sure. These are all your standard wires to start off with. These are your Emerald 150 for your femoral approach, and you got your 260 for your radial approach. Reason that if you're going through your radial artery, you get a lot of issues with spasm and tortuosity, that you can lose position of your wire, and once you get it in and out, you might spasm and lose access. So what you do is you get a long wire, you keep it in the heart, opposed to in the femur, where you can go in and out of the heart because it has a big arch. The aortic arch has a lot of room to it, and it'll just follow right through. There's nothing torturous about that you won't be able to get through. So electrodes, normal saline, blood gasket, angel, defib pads, balloon pump kit. Balloon pump kit? What do you mean balloon pump kit? Oh, I see. You need to have a pressure leg for your balloon pump here. That's what it's saying. Oxygen extension. Miscellaneous product here, alcohol pads, see, needles, caps. Good. And those are your angio casts over there. Those are long sheets. All right. What we got here? Time, gloves, cabin, cleaning supplies, patient supplies, journals, suction. Okay. Got here. These are pads right here. These are not. They absorb. One side's absorbent, one side's not. It's called Chuck's pad. Defib pads. Another portable monitor here. All right. Phillips machine. This is computer automated to designate what area of interest is. So you're gonna go cardiac, left coronary. You got your frames per second. Usually they want 15 frames, so you don't get too much radiation. Right coronary is here. They're all preset for that. The rotor maps are something that we use for when we want to see the vessel and the whole time instead of just pushing on the pedal and seeing what was going on. We X-ray that while we put dye. We flip it to have a negative image, and then when we hit the roadmap, the computer automates a path for you where it's been at, and it just leaves it there so you can keep following through all your X-ray, kind of like a guiding path. So, IVIS, Volcano, all controls here. That's your assist here. This is your assist manifold here. So what it is you pre-program all your settings for how much pressure you want to put into each coronary, angiocath or your catheter or your vessel, and that way you're adhering to the proper standards, and you won't rupture a vessel or cause a dissection. Also, this is this machine helps you eliminate the chance of getting a bubble into the line, which can cause a coronary infarct. So this has gone through some sensors and pumps here. This is your contrast going in here, reservoir. Your settings going in here, but these are all sensors to see if there's any air bubbles or any void in the solution that'll get it to automatically freeze and stop. That's your pressure sensor here, which this really soft area. It's a diaphragm that feels the changes in pressure, so it'll translate into your pressure. Computer monitor system here. Got all your controls here. This is a lot less complicated than what I'm used to. You know what I mean? Instead of the 3-button push, 4 different knobs. This one's a table height right there. This is your II, table height. You got your table controls here, like that. All right. Then you got your this. That's this. You got to be able to do that quick. Okay. Good. Shutters. Pretty simplistic here. Fluoro save means if you want to save an image that wasn't, if you hit the fluoro button here, it'll X-ray, but it won't save. If you hit the cine button, it's a lot more radiation, a lot faster frames per second, and it saves automatically. So those are two different. So if you want to save radiation, you hit the fluoro button instead, and then you hit the fluoro save, and it'll put it into your archive and it'll save it. But if you don't, it'll disappear. It'll never save it. You do always save radiation exposure, but you don't see the images. Stored, recalled positions. If you want to program a position like this, and that's the area that the doctor likes, you program that. And then once you're out of position and everything, you just push that automated button here, and it'll just go right to that exact. Because it's important when you find a lesion that you get the exact image, so you don't have any discrepancies in your approach or in your any elongation or discrepancies in your image that you're producing from a different angle, which, like I said, the problems could be elongation, foreshortening, and it can give you a false sense of position. And we don't want that when we're dealing with the coronary stent, because we're dealing with millimeters. You're off by a portion of a millimeter, and you're into bad tissue. You could cause a rupture or a dissection, or just not fix the area and have a stenotic region form right after. All right, computer system here. Got the Cerner system here. This is IVIS, so you can sort of intravenous ultrasound. Cerner for your X-rays here. Boom. All right, banner. Good. Extra machines here. This is like your spare equipment, just your stock. All right, all your stents and balloons. Non-compliant balloons mean that there's no compliancy, meaning that when you get to the pressures that they're nominal, this nominal pressure. Nominal pressure is 12. You have to go to nominal pressure to get the non-compliance, meaning that the balloon won't not flex. Once you get to 12, it's solid stiff. You got 3.74. You got to be able to get to nominal pressure to get that. The compliant balloons, they have bend to them, so they open up really soft. they balloon where there's less pressure, they open up. When there's more pressure, they stay, but eventually they pop. So what you want to do is you want to balloon the really tight area so the sides open up, and then it starts pushing, and there's a support on both sides so the balloon won't slide. So it opens up on both sides like a wishbone, is what they say, and then all of a sudden it all pops open. You get these ones here for when you put a stent, because if you put a stent in, you have to make sure that you inflate to nominal pressure, or else the struts will not lock in position, thus leaving that stent compromising a bit, and the potential to reach the nose. Just different types of stents here. Promise. Okay. That's about what we deal with on a daily. This is a very small lab here, but the link system is just this is a portable, implanted device that records arrhythmias as it happens, and we use that for people who have sudden, onset arrhythmic behavior of the heart that need to be diagnosed and possibly ablated if it causes issue, or if it reaches a certain standard. And that's about it. Nice lab. It's cool. Educational section here. Scheduling section here. Resources. All right. All right. All right, guys. That's just getting familiar with all this Cathlab equipment. This is what I got to find out in the first day, because I start working now. I got just a couple minutes to get this all under my belt. And the next case coming in, we got to go now. That's what we do. Cool.